Traveling abroad for medical care can seem overwhelming. Whether you are coming to one of our many Cleveland Clinic locations in Ohio, Florida, Las Vegas, Toronto, Abu Dhabi, or London, your health is our top priority. And Cleveland Clinic Global Patient Services is here to help you before, during, and after your visit. Throughout this video, we will often refer to Global Patient Services as GPS. Before you travel to Cleveland Clinic, there are a few ways you will need to prepare. Make sure you have passports for each person that will be traveling. These passports must be valid for at least 6 months. Bring all medical records translated to English, including current medications, biopsies, and electronic copies of any imaging and x-rays. Contact GPS if you are traveling with oxygen or require kidney dialysis, so arrangements can be made when you arrive. If you are taking blood thinners, be sure to inform your sponsor before you travel, since some blood thinners must be discontinued before surgery or procedures. If your sponsor is providing transportation from the airport to your hotel, make sure that you have that information ready for your arrival. If you do not have a sponsor, please contact GPS directly. Once you arrive and settle in the area, follow your transportation instructions and register as a patient at Cleveland Clinic's Global Patient Services office. The GPS offices are open Monday through Friday, 7:30 a.m. to 4:30 p.m. Be sure to bring your passport and all other necessary documents. Upon arrival, our team will schedule an orientation with you that covers the logistics of your treatment plan at Cleveland Clinic. We will provide you with instructions on how to communicate with GPS when you need help and expectations for your treatment. We will also help you download the MyChart mobile app. This allows you to easily access lab results, updated appointments, and medical reports on your phone. With MyChart, you can stay in contact with the Cleveland Clinic medical team even after returning home. If you will be staying for more than 1 month, we will also provide you instructions on how to secure a local phone number. This is important for communications with GPS and Cleveland Clinic throughout your stay. We want your arrival to be as seamless as possible so that you can concentrate on your health. The Cleveland Clinic Global Patient Services team works closely with your entire medical team. We are your partners in care while you are here. We will schedule your appointments and let you know the times and locations of your appointments. We can help you communicate with your doctor's office and the pharmacy when you have any questions. During your appointments, it is important for you to understand your doctors and for your doctors to understand you. We will provide interpreter services, and when live interpretation is not available, technology like telephones or tablets will be used to ensure that you can communicate with your caregivers. Family members are not encouraged to help with interpretation. The GPS team will be in touch with your sponsor or medical team in your country throughout your time here, keeping them updated on the progress of your plan of care. If needed, we will obtain authorization for treatment related to your initial diagnosis. If you have other health concerns you would like to have evaluated while you are here, we will have to ask your sponsor for additional approval. If coverage is denied and you wish to proceed, you will have to cover the costs out of pocket. If your visa will expire during the course of your treatment, we can request a letter from your doctor that confirms you are receiving medical treatment at Cleveland Clinic. You can include this letter in your visa extension application to the USCIS. If you are sponsored by your government, there are several matters related to your stay that are not handled by the Global Patient Services team, and you will need to connect with your sponsor directly. These include help with your personal finances, health coverage for your companion or escort, passport renewal or notarization of clinical documents. Depending on your specific diagnosis, you will experience different types of medical situations while you are here, and you may be faced with many decisions related to treatments and procedures. Do not hesitate to ask questions if you have concerns, such as, why is this procedure necessary? Are there any alternatives? What are the risks involved? What happens if I don't have this treatment? What can I expect the outcome to be? If you are having surgery, there are a few important things to note. Prior to surgery, your provider will ask you to sign an informed consent which acknowledges you are aware of the risks and benefits of your procedure. It is important that you do not miss any appointments, including preoperative testing. A missed appointment could lead to additional testing and may even mean postponed surgery. If there is ever a time you cannot make it to a medical appointment, contact your Global Patient Services team right away to cancel and reschedule. Your sponsor will also be notified, and this may affect your coverage and delay your treatment. As an outpatient, if you experience a change in your medical condition, you may be referred to a Cleveland Clinic emergency department for further evaluation. Your Cleveland Clinic care team works together to provide world-class care and will include nurses, physicians, respiratory therapists, and other specially trained professionals. They all contribute to different aspects of your care. Cleveland Clinic is also an internationally renowned academic medical center. This means some members of the care team may be in training, gathering valuable experience in their field. You should speak to your doctor if you have any questions or concerns. If your condition requires a hospital stay, you will always have access to interpreter services so that you can be in close communication with your care team. The Global Patient Services leadership team will also visit you at the bedside to support your experience of a seamless patient journey in a culturally oriented approach. Private rooms are not always possible, but we will do our best to accommodate you when available. Each hospital room will have a phone for local calls, television, and Wi-Fi. While you are in the hospital, your meals will be delivered to your bedside. A variety of cultural menu options are available, including halal, kosher, and vegetarian menus. All of these can be adjusted for any dietary need. For patients under 18, a parent or guardian must be available to your healthcare team in person or by phone at all times. For the comfort of your child, parents are expected to spend as much time as possible each day with their child and should provide support with daily tasks such as changing diapers and feeding meals. Cleveland Clinic visitation guidelines can change at any time. Please visit the Cleveland Clinic website at clevelandclinic.org/patients/international or ask the Global Patient Services team for updated visitation information. All visitors to the Children's Hospital must be 18 years or older unless accompanied by an adult and have a valid photo ID to receive a visitor's badge. During visits, please make sure you and your guests keep a low conversational tone at all times out of respect for nearby patients. Once your doctor determines that you are ready to leave the hospital, you may be discharged to a post-care facility if you still need more care. Your medical team will recommend the best facility and you will be transported there. Even though the post-care facility may not be part of Cleveland Clinic, your care plan will be followed. Your Cleveland Clinic medical team will be in constant communication. You will continue to have access to interpreter services when needed, and your family members may visit according to the policies of that facility. It is important that you work with your team of therapists to ensure your recovery. As healing improves, they will help you learn to care for yourself in preparation for your return home. When it's time to return home, all travel arrangements should be taken care of by you or the sponsor. GPS does not receive any travel information or updates. For the release of your medical records, GPS will ask you to sign a consent form. You will then receive an email with all of your records and a CD with your imaging. The CD will be available for pickup at Global Patient Services. We recommend you request your imaging CD at least 3 days prior to your departure. You may also need to stop at the pharmacy to pick up any prescriptions that have been ordered. Once you're home, Your medical care will be taken over by your local physician, so be sure to follow up with them as soon as possible. The journey to health may take you many miles from home, but Global Patient Services is here for you every step of the way. Whether you are coming to Cleveland Clinic in Ohio or visiting one of our other locations in Florida, Las Vegas, Toronto, Abu Dhabi, or London, we care about your health. We are here to answer your questions and support you. Our goal is for you to recover quickly so that you can return home to your family and friends. Thank you for choosing Cleveland Clinic for your medical care.